Hello, my name is Sohini Banerjee.
And my name is Sanchali Banerjee.
We are Team BubbleOn, and our product is a novel nanobubble that enhances epileptic treatments.
On July 6, 2019, Cameron Boyce, a Disney star, passed away in his sleep due to a seizure that resulted from an ongoing medical condition. Epilepsy is a neurological disorder, causing electrical storms in the brain, resulting in seizures, unconsciousness, and even death. The cause of a seizure is seldom known, so patients take additional medication to suppress it, inducing potentially fatal side effects. The occurrence of an attack cannot be predicted either, so by the time a patient takes medication to control the attack that has already started, it may have already spread to other parts of the brain.
We propose a nanobubble that reacts to developing epilepsy attacks and discharges medication, subduing the impact and saving lives. Nanobubbles are bubbles containing medication that are injected into the bloodstream, releasing their medicine once they burst. For the nanobubble to be attracted to the positive electrical surges in the brain, its shell must be negatively charged.
Patients will inject several nanobubbles into their bloodstream for enough to flow to the brain, in a similar way to diabetic patients. They will act as gatekeepers at different parts of the brain, allowing an electric surge in any section to be pacified by nearby bubbles. Our nanobubbles polarize in the presence of the electric field that develops during an attack. The resulting electrostatic force between nerve cells in the bubble stretches the bubble, rupturing it at a certain threshold. Once it bursts, it ejects medication towards the site of the attack, along the lines of the electric field between the nerve cells and the bubble. The medicine pacifies the nerve cells, preventing the attack from spreading.
Our business strategy eliminates conventional epilepsy therapy and creates a market demand for epilepsy treatment that does not have any side effects, yet provides high assurance against unpredictable attacks that may even lead to death.
Common epilepsy medications are categorized as maintainer and rescuer medicines. Maintainer medicines are taken regularly, however, they are administered regardless of whether there is a seizure, which causes excess medicine to be released, causing side effects. Rescuer medicines are taken if an imminent attack is sensed. However, an attack may be undetected, particularly during sleep, making it too late to prevent its impact when realized.
The whole brain is stimulated through vagus nerve using a surgically implanted battery-powered device. It impacts the entire brain since the site of the attack is not known beforehand. Unlike common epilepsy therapy, our nanobubble does not cause unnecessary brain stimulation, springing into action only when needed and consequently reducing any side effects. In the process, it raises the quality of life and reduces premature demise due to epilepsy attacks. Our nanobubbles create 24-hour assurance that an attack is prevented, in addition to discharging medication safely, only at the site of the attack. This allows the use of medicines without worrying about its impact on other parts of the body. Our strategy eliminates the red ocean market dominated by conventional epilepsy therapy using traditional medicines and vagus nerve stimulation. Our strategy establishes the blue ocean market using our innovation with greater assurance and safety.
The Global Epilepsy Market Research Report says that the epilepsy market will grow to $9.5 billion by 2023, growing annually at 8.2%.
Our market begins with the Tier 1 non-customers, which include epilepsy patients with uncontrolled seizures that often require hospitalizations, significantly increasing the cost of the treatment. Our next market segment includes epilepsy patients who are somewhat able to manage their seizures. We believe that the Tier 2 and Tier 3 non-customers would consider the long-term side effects of epilepsy medicines and would ultimately resort to our innovative treatment.
It takes 3 to 7 years for therapeutic devices to enter the market. Based on industry trends for similar businesses, we expect our product to enter the market in 5 years.
Our product is founded on viable biomedical technology. There are few nanobubble or microbubble-based products in the market for treating diseases. All the competitors have been active at least 7 years since being founded, proving nanobubble technology's viability. However, the companies use external stimulus, specifically ultrasound, for their products. Alternatively, our product polarizes and bursts using the electricity of seizures. Given the high infrastructure cost of producing biomedical devices, we intend to reduce the initial capital. By shifting the capital expense to a pay-as-you-go model, we reduce the amount of investment needed for the first 5 years.
We will compete for the NIH programs during the creation of our product. Our funding sources during operation include venture capital and company revenue.
By investing in our solution to treat epilepsy, we can save many lives in the future.
This concludes our presentation.
Thank you for listening.